Welcome everyone. We're excited to have you. Kate, I'll turn it over to you to get us started.
Absolutely. So I'm very excited today to introduce Lauren Cornell, and her topic today is IBS in athletes, how to fuel while following the low FODMAP diet. But first, I'd like to talk a little bit about Epicured. Epicured is a healthcare company that really utilizes food as medicine, and we have paired Michelin star chefs with the best doctors and dietitians and created really a wonderful community for these types of events, webinars, clinician education events, and just a number of really awesome events to really spread the word that food can be helpful for all of us for good health. So Epicured translates medical research into delicious food for patients requiring prescriptive diets. There's many benefits of Epicured. You can use Epicured for diagnostic support. Maybe leveraging 5 to 7 days of elimination friendly low FODMAP food can really help identify if your patient has FODMAP sensitivity or not. And then if you learn that they do, then educate and do the in-depth education. It really minimizes stress and provides a peace of mind. The low FODMAP diet can be complicated, and Epicured can help with keeping the patient adherent to the diet with minimal effort and keeping it all very easy. Patients can relax knowing that their diet is being provided to them appropriately, right to their doorstep, to really soothe their digestive symptoms. And one of the best things about Epicured is just the variety of plant-based foods, fiber, and nutrition. It's really Mediterranean diet with a twist, with lots of plant foods and fiber for a balanced diet as well as good gut health. So our first menu has really been focused on digestive health. All our menu items are low FODMAP for IBS, Crohn's, colitis, and small intestinal bacterial overgrowth, as well as gluten-free for those with celiac disease or non-celiac gluten sensitivity. And as I mentioned, it's truly Mediterranean with a twist. So we know the low FODMAP diet is complicated, but certainly it works. And patients that have longed for nutritional therapy to help them with symptoms, we finally have the science to back up what they've known all along. And that is that the low FODMAP diet can work for most patients and up to 86%, in fact, of people with IBS. And we really have a wonderful network of major health systems that we work with, a number of thought leaders, including my friend Bill Che, Tony Lembo from Boston, as well as different independent private practices, and many patient advocacy groups such as the Crohn's and Colitis Foundation, IFFGD, and the NCA. So without further ado, I'd like to introduce Lauren Cornell and tell you a little bit about her. She's a registered dietitian in Los Angeles and founder and CEO of Lauren Cornell Nutrition, which is a clinically based private practice in Los Angeles, California, serving both pediatric and adult patients. Lauren specializes in sports and performance nutrition, as well as GI diseases and disorders, such as IBD, IBS, celiac disease, small intestinal bacterial overgrowth, intestinal resections, pancreatitis, eosinophilic esophagitis, enteral nutrition support, and functional GI conditions. Lauren also treats patients as the GI dietitian for Cedars Sinai Medical Group's GI department. Lauren sits on the chapter medical advisory committee of the Crohn's and Colitis Foundation in Greater Los Angeles. She also serves as a member of Monash University's Low FODMAP Diet US Advisory Board. She also leads the IBD workshop of the Academy Dietetic Practice Group, Dietitians, and Gluten and Gastrointestinal Disorders. When Lauren is not nutritioning, she finds enjoyment in her active lifestyle, which includes scuba diving, running, dancing, and spending quality times outdoors. She really understands the level of collegiate athlete in competitive sports, as she was a competitive dancer for over 10 years. So without further ado, I welcome my friend and colleague, Lauren Cornell, to talk to us about IBS in athletes, how to fuel while following the low FODMAP diet.
Awesome. Thank you, Kate. Can you guys see my screen okay?
Yes.
Right. Awesome. Okay, perfect. Not the most technologically inclined, I'm just going to be honest. Thank you for that intro, and I'm so excited about this topic. In fact, I will admit putting this together was a little bit stressful in the best way, because this is truly a topic that marries my two passions, so sports and performance nutrition, and then GI nutrition, or nutrition for GI disorders, or the digestive challenged. And so there's just so much that I wanted to say. And so I'm packing it in, and there's a little bit of like 101 information and a little bit of like really reminding you of some of the biochemistry aspects and kind of digging into the advanced. So we'll just whip into it. So first things first, our objectives today are to identify the challenges that athletes with IBS face in terms of fueling and managing symptoms. And then we want to understand how to avoid overtraining and underfeeding for athletes and active individuals on a low FODMAP diet. And the reason we mentioned the low FODMAP diet is because it's the first line therapy for IBS. And then finally, how to apply the low FODMAP diet to all aspects of athletic fueling. So from a balanced day-to-day diet to hydration, which would include fluid and electrolytes, and then supplementation during athletic events. So supplementation of electrolytes and carbohydrates predominantly, and then understanding how this differs from otherwise healthy athletes. So challenges faced by athletes with IBS. There's a lot. I would say there's just so much that needs to be considered for an athlete in general when talking about their nutrition and just the different aspects of it. And then we throw in the component of IBS and what happens to the body during exercise, specifically what happens to the GI tract during exercise. And it's a lot to consider. So we're going to cover it all. So just a quick recap of what FODMAPs are and what the low FODMAP diet is. So FODMAPs are malabsorbed short chain carbohydrates. So the acronym stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So these are things like lactose, galacto-oligosaccharides, and such, right? Fructose, sorbitol. You guys know the drill. Most people on here, I think, are probably have had a peek at the low FODMAP diet. So in short, basically what happens is a person with IBS would consume high FODMAP foods. And then what occurs are more or less two different things. Hyperosmolarity situation, so there's water delivery into the intestinal lumen, or there is fermentation or gas production by the bacteria in the intestines. I always like to make the analogy of kombucha. So when a patient's asking me like, well, you know, what happens? Why does the fermentation cause, you know, the gas and the bloating and everything, which leads to the luminal distension, right? And then we feel the symptoms. And I like the analogy of thinking about kombucha, right? Fermented tea. And I tell them, when you open a kombucha bottle, there's fizz. We want the fizz, we want the carbonation, but that carbonation is not implanted. It's not like we put it through a soda stream. That carbonation is a byproduct of fermentation. So that SCOBY, or the starter basically for the bacterial fermentation of kombucha, ferments on the sugar that we give it, or the carbohydrates that we give it, and then it creates that gas. And so that's exactly what happens in the intestines when there's FODMAP presence, or there's a bacterial imbalance, or just simply with IBS. And then the pain and the discomfort comes from the presence of visceral hypersensitivity, which is the case with IBS. So just a quick little recap. So why is this a challenge for an athlete with IBS? For starters, available energy. So carbs are an energy source for an athlete, probably the main source. FODMAPs are carbs. So a low FODMAP diet could equal low energy for the athlete. So the disadvantages for that, of course, would be a decrease in muscle glycogen stores. So that's like the long-term stores of energy for an athlete or for anybody. A decreased potential for readily available energy via dietary carbohydrates that are just consumed before, during, and after exercise. And the ability to maintain energy during high intensity and endurance activity becomes limited as a result of that, right? If the patient or the athlete hasn't had the proper guidance from a registered dietitian on how to administer the low FODMAP diet or to manage their FODMAP intake. A low carb diet, if they end up falling to that, unfortunately would mean a reliance by the athlete on, you know, just by the sort of the scale, right? If you're going to lower the carbs, you're going to increase your protein and your fat intake. And one of the things we always tell an athlete is, especially right before they're about to train or do an event, you probably don't want to be consuming high fat and high protein foods because they just require a little bit more effort in digestion. So you're likely going to be trying to digest those foods as you're performing or as you're doing your exercise, and you don't want that. So if the diet is generally higher in those foods, you're also going to probably end up with this guy over on the right that's kind of keeled over with a little stomach cramp, and probably dealing with some IBS symptoms as a result of that as well. There's a study by Sinai and other authors that showed that protein intake increased GI symptoms, incidence, and severity compared with both just the intake of glucose and water. So they had 3 different samples, possibly due to the tolerance difficulties under the exertional heat stress conditions as well. But really had a lot to do just kind of over and over in time when it's been tested to the protein intake right around exercise. We'll talk a little bit more about that too. And then, you know, not to mention, you see the bottom 2 images. I've got this guy on his bike cheersing with some coffee, and then I've got this very exhausted looking track athlete. Basically, with the exhaustion, your athlete's more than likely going to rely more on caffeine intake to keep their energy up. And then we know that caffeine is a GI stimulant, so then that could cause problems as well. And then sleep is always a consideration, and wanting to optimize sleep in athletes is huge. So we don't want to mess with sleep by increasing caffeine intake that way, not to mention cardiovascular conditions, anxiety, all that stuff, right? So really important that we don't want to mess with the available energy in the diet. Okay, and then this is probably my favorite slide. So hopefully you guys can see this well. I pulled this from a wonderful study that evaluated exertional heat stress associated gastrointestinal perturbations on potential Olympic athletes for this year. So it's a newer study, and I love this figure. Let's go over this really quick. So this is what happens to an athlete or not, or I'm sorry, an athlete or with IBS or not with IBS during exercise. This is what goes on in the GI tract. So there's 2 sort of pathways that things happen. There's the circulatory gastrointestinal pathway and the neuroendocrine gastrointestinal pathway. So let's look at the first side. So the biggest thing is that there's a redistribution of blood flow. So that's going to go to the muscles and the peripheral circulation, and that's going to come away from the splanchnic hypoperfusion, or the splanchnic area. So it's going to cause splanchnic hypoperfusion. So basically that's a fancy term for a decrease in blood flow to the abdominal area and to the GI system, right? And part of that can also cause, or another thing that can happen there is that you can have GI ischemia. And the biggest problem with that is injury to the intestinal epithelial cells, which are responsible for a lot of healthy functioning in our digestive system, inflammation to the epithelium, damage and dysfunction to the gastrointestinal epithelium, and the tight junction stability. So then we're talking about intestinal permeability being increased. And then lists a couple more extreme things on the bottom. I say extreme, but it can happen. So it's talking about SIRS, CARS, endotoxemia, and things like that. These are real considerations for an athlete with IBS, or just an athlete in extreme situations too, extreme conditions of temperature or just prolonged or intense exercise. And then on the neuroendocrine gastrointestinal pathway side, there's an increase in the sympathetic drive. There's a decrease in the parasympathetic drive, sympathetic drive. Myenteric and submucosal plexus deactivation, an increase in stress hormone release. So this is kind of, I think, where everybody's like, ding, ding, ding. So an increase in cortisol and a few other stress hormone levels, which then induces a reduction in GI motility, in digestive functioning, and absorption of nutrients. So then we end up with malabsorption, and then both of those pathways get us to GI symptoms or potentially further health complications. So this is really sort of at the crux of everything that we're trying to prevent and consider when we're looking at helping fuel an athlete that has IBS. So there are risks involved that are obviously higher when somebody already has a pre-existing GI condition like IBS, in that it's pretty much a guarantee that some of this is going to happen if things are not fueled properly or accounted for. And we just have to remember that exercise is a form of oxidative stress on the body. It's incredibly beneficial, and there's a lot of studies that show that athletes or people that are active actually have much healthier gut microbiota and a healthier bacterial balance and just healthier GI tracts overall. But you really have to take care of yourself. So it's about being a little bit more intentional. So a couple other things. So these exacerbating factors. So intrinsically, we're looking at exercise intensity, duration, the modalities of exercise, conditions for exercise. So that's where the heat thing comes in, particularly of note. And I oftentimes give a workshop like this right around this time of year, because this is where everybody's really thinking about it, because it's getting hot. And then NSAID use, and it's big in athletes. And we'll talk about one particular situation that I think stands out in a lot of people's mind that follow different athletic events. But, you know, athletes endure pain and injury, and they're also trying to reduce inflammation because that reduces their recovery time, and it also reduces their incidence for injury. So NSAID use is a thing. And in fact, oftentimes in the practical world, when I'm just chatting with other, you know, I'm a runner. So if I'm chatting with other runners or other people that are just, you know, active individuals, I will oftentimes hear people say, well, I took a little ibuprofen before I went for my long run and things like that. And I've certainly done it myself, just if you've got something going on that you just need a little bit of help with. And so it can get out of control with someone who is semi-pro, pro, or competitive in the athlete space in terms of overuse. And then extrinsic factors, exercise, or excuse me, the individual feeding intolerance during exercise. Oh, I just realized, I think these are flipped, guys. Sorry, that's intrinsic. Individual feeding intolerance during exercise, a predisposition for or an active GI disorder. So we talked about this a second ago. Bacterial abundance and diversity of the gut microbiota. So if there's a situation of dysbiosis or SIBO or something. And then eating disorder behaviors. This is huge. In fact, I feel I don't talk about it enough in these slides. There are a few slides on really kind of constantly evaluating an athlete, and particularly an athlete with IBS, for disordered eating thoughts and behaviors. That is huge for the nutritional management of an athlete, and specifically for an athlete with IBS. So we'll talk a little bit more about that. But symptoms, GI symptoms are just gonna likely occur more frequently during exercise for those with and without IBS. And so it's just going to more frequently interrupt or prevent training and competition for somebody with IBS. Talking about more, again, I think this got flipped. That's really the extrinsic. So strenuous exercise, just a couple of fun science facts that I liked and wanted to stick in here. So strenuous exercise increases pro-inflammatory and inflammatory response to cytokines. So I listed a few that it specifically affects. You see that TNF is listed in there, so that's tumor necrosis factor. So if you work with patients that have IBD, that's going to flag a little bit, right? Because more in inflammatory bowel disease, we're looking at inflammatory markers more often, and you hear about, you know, different medications that they're on, particularly a class called anti-TNF. Sorry, guys, anti-TNF. So, you know, this is sort of just explaining further that we don't want to increase pro-inflammatory or inflammatory responses, right? But strenuous exercise does that. So we'd have to keep that into consideration. And it does that to the effect that is similar to sepsis. So that feels a little scary to hear. GI symptoms are increased to a greater extent when endurance exercise is conducted at temperatures that are high. So just wanting to consider that in terms of seasonal nutritional advice. All right. A couple of other challenges that athletes with IBS face is that a lot of sports supplements are high in FODMAPs. So these are three big ones that I see a lot of athletes taking. So whey protein, probiotics, and fiber supplements. So whey protein is tricky because a lot of well, I should say not a lot, but some of them on the market can be low lactose. And so then they're low FODMAP, but whey protein specifically just sometimes does not digest well for some people, not even just people with IBS. So just wanting to kind of consider that. I see a hand raised, but I think we're gonna do a Q&A at the end, just FYI. And then probiotics and fiber supplements. So probiotics, we'll talk a little bit about this at the end. I kind of touched on supplements very quickly because I think that's a whole nother can of worms. But probiotics, you just want to, it may be messing with the gut microbiome balance. And there's already things being messed with in that realm in terms of when you're considering an athlete with IBS, right? Because there's the IBS and then there's the exercise component. So just wanting to consider that. And then fiber supplements in some capacity can be high in FODMAPs because FODMAPs contain fiber or are fiber. Okay, and then just this is a quick list of high FODMAP ingredients commonly found in sports supplements for you guys, just reference really quick. And these are in a lot of different sports supplements. So then we have another list, and this is low FODMAP ingredients in sports supplements. And I just listed a couple of my favorites and my go-tos in terms of some low FODMAP sports supplements. We'll talk about that a little bit more towards the end of the presentation, but I just want to list a few. And I think, you know, Gatorade sort of gets a bad rep. I went to University of Florida, so I'm going to give them a little shout because that's where Gatorade came from. But Gatorade's actually really nicely absorbed for most athletes. It's the G2, so that's the sort of like the sugar-free version of Gatorade. And, you know, I think Powerade and a couple of others have this version. So they're going to use some sugar alcohols that are going to include some FODMAPs. But these are a few. The Martin supplement all the way to the far right with the fancy black and white packaging is a big popular one right now amongst runners. I'm a huge fan of Scratch Labs. A lot of people like the Untapped. Cliff is a huge name that people know. I see the Sarasport citrus more in like Canada and Australia, but wonderful brands. So just wanted to give you guys a couple of like practical, just like, oh yeah, let me just grab these and use them on my athletes with IBS. And then food fears is a huge challenge for athletes in general, and then people with IBS in general. So then you combine the two and we've got a big challenge. So athletes with IBS have an increased fear of food because they have an increased fear of inducing symptoms, because it's not just for them, not that this is not to downplay this for just the average person with IBS having the challenges and the you know, decreased quality of life because of their GI symptoms. But then you throw in the component of the athlete not knowing when those GI symptoms are going to arise. Are they going to compromise their training, which is so important leading up to their competitive event? Because, you know, it's really within the training, arguably, if you ask any coach or athlete, that the magic happens, and then you just hope that you can consistently execute that when it comes to the competitive event, right? But then, you know, the real trauma or saga would be if it happened during the actual competitive event, and it happens. And so training just as much as, you know, nutrition is just as much of an integral part of training as is the exercise in the physical portion of it. So you might see more athletes with IBS more inclined to choose to not eat altogether. I've absolutely seen that at an advanced level, or to postpone proper fueling with the idea that if they just don't eat before their competition, wait till afterwards, that they'll be fine. We'll talk about why that's not a good idea. So just thinking about this and the overall idea of malnourishment. Okay, so timing of nutrient intake is a challenge for any athlete, IBS or not. And it's heightened in those with IBS due to the compromised digestion and either the slower or the faster GI motility, whatever happens. There's a couple of concepts, they're sort of combined, but there's the idea of carb periodization or training low, which utilizes the idea that training with low carbohydrate availability will increase the muscle's ability to use fat for energy during exercise. It's controversial. It's also highly individualized. So it might feel like it works really nicely for one athlete, and I do see it. I see it a lot. And I think as dietitians that are helping an athlete, especially an athlete with IBS, to understand what works best for them, you really have to listen. So you have to really think, ask them, what's tried and true for you? What do you feel comfortable with? What's never really caused you symptoms? And then listen to that, because that gives you information about what that individual, what their body prefers, right? But this idea comes from, and I'm going to bring you back to biology class. So the mitochondria in the cell is, remember, the powerhouse. That's the part of the cell that's responsible for sort of converting the glucose and the dietary carbohydrates into ATP or into energy, right? So the idea is, if you eat a low carb diet for a while, it will increase the basically like the mitochondria, and it'll increase its ability and its efficiency to then digest and use dietary carbohydrates when they do come in to create energy. And what actually ends up happening most of the time in practical application is that it downregulates that process. And that's been shown to happen in a couple of professional athletes, and sometimes it happens too late. But for some people it works. And so the most common way to train low is to do a fasted workout or to train without eating breakfast. So the big question is, like, does this work as effectively for an athlete with IBS? And we'll talk about why that might not. And then timing, otherwise, like the slide indicates, like, wanting to digest or eat easy to digest carbohydrates that are readily available for fuel before a workout, saving the protein and the fiber and things for after the workout, trying to get that protein within that 90-minute window post-workout is ideal. All these things, there's all this timing to consider, not to mention just like, did the athlete get enough sleep before the events that typically start early in the morning, and so on and so forth. So there's a lot of challenges there. All right, so this is the slide chatting about use of NSAIDs for pain management. Not going to go into too much detail about this because it's just a factor. And so you just want to be able to have an honest conversation about your athlete. But the big story is, and I don't mean to like post all these pictures of her, but I just wanted to show the process. So in 2004 in the Athens Olympics, Paula Radcliffe was unable to finish the marathon because she started to have really severe cramping, bloating, and she had the urge to defecate. She basically had to quit the race, which you see here. It's heartbreaking to see that. And this is really what these people, this is their identity. This is what they work for their whole lives. So it's devastating for them. And, she claimed to be completely hydrated. So did her coaching staff. The heat did not apparently have anything to do with this, although we'll talk about that a little bit. But she did admit that she had a history of NSAID use prior to the event. So that was just like a factor, and it's not, it's not uncommon, and it's not illegal, and it's just a consideration that you have to make when you're dealing with athletes with IBS in particular. Okay, so how to avoid overtraining and underfueling while on a low FODMAP diet. This is huge. This is probably the biggest consideration when you're dealing with athletes and IBS. So for athletes with IBS, you want to identify the sources of nutritional information for the athlete. So are they getting their nutritional information from their coaches? Do they have a dietitian? Do they have a team dietitian? Team dietitians are definitely getting more common, but they were rare. As of like even within this decade, they were rare. Are they getting their nutritional information from parents, other team parents? When we're talking about athletes, we could be talking about little guys too that are having, like team snacks and things like that. Social media, obviously a huge one. And then set the record straight for which sources the athlete should trust. And that just is really based on developing a great rapport with the athletes that you work with. You want to instill confidence in the athlete's food choices by running different real life scenarios. So you can accompany them to their training tables or their fueling tables, go to the training facilities, have them walk you through things like, are there supplements laid out for them to eat and have readily available before or after workout, things like that. You just want to kind of have your hands in and really be aware of. Reviewing menus for, their favorite restaurants and things like that. In my experience in working with professional athletes, even the highest paid professional athletes don't have the best diets and will resort to fast food and things like that. So you really have to meet them realistically where they are and help them in that position to understand like where the FODMAPs lie in those situations and what their best food choices would be. And this is maybe where something like Epicured would come into play because it makes it just simpler. It's turnkey for them, right? And then you want to present the information to the athlete in several different ways. Remember, we've got different learners, but also athletes are bogged down. They're probably concerned and stressed about their performance, what they have to remember if they're, depending on what kind of athlete they are, what their plays are, and then they have to remember all these different things, these positions that they're putting their different body parts and muscles in as they're doing their moves just to execute things, right? So you want to make it as simple and fun and practical as possible. So just that is hugely a part of how to make sure that a patient or an athlete is eating enough food. And it sounds so simple, but really it's just developing a good rapport with them, making the information really simple and making them confident in that, and then making it really easy for them to execute. Okay. And then how to avoid a low calorie or low carbohydrate diet. So this is really essentially avoiding the underfeeding part, right? Hold on, I'm going to move some things around so I can see a little bit. So identifying any eating disorder behaviors or thoughts is constantly a necessary part of reassessing an athlete's nutritional status, right? You want to consider this mainly or more heightened for any positions or any athletic roles that require a specific size. So wrestlers, rowers, specifically the coxswain position in crew teams, but also remembering a few things. Athletes at a competitive, semi-pro, Olympic, pro level, anybody that's got an audience, which is pretty much most athletes, are at the scrutiny of spectators, and they are thinking about that. So they're thinking about body image a lot and how they look and do they look the part, right? And so other factors that can influence eating disorder behaviors, peer influence, just simply listening and talking with their team and, hearing them say like, yeah, I don't eat before an event because I want to like look slim on camera, or if another athlete on their team has IBS or doesn't and just like heard from somebody else that it's not a good idea to eat before, during, or after exercise, right? So just peer influence in general. The character of an athlete, like they're always striving for perfection and greatness in general, right? So that comes with, if any of you are familiar with working in the eating disorder space, which I think all of us probably have some experience with on some capacity, it's a control thing, it's a perfection thing. And really wanting that to come across not just in their athletic performance, but in their appearance too. And then body types for other athletes. I can't tell you how many times I've seen runners posting about it on Instagram or cyclists and things like that. They typically have this very lean body type, and runners and cyclists posting or talking about very openly that, they oftentimes hear, oh, you don't have a runner's body. I wouldn't have guessed that. Things like that. So that starts to take a toll. So just wanting to have constant conversations and just kind of picking around and just to see if that's existing or if that's influencing food decisions or not eating decisions. All right. And then how do we apply the low FODMAP diet to all aspects of athletic fueling with athletes that have IBS? So first things first, balanced diet, right? So with athletic fueling, we're looking at carbs before training. So easy to digest carbs, individualized to the athlete's preference and tolerance. And I'm guiding this a little bit with like what I use, but I would really say it really comes down to the individual and what the individual needs. So the dietitian, you guys are in charge of that. You know what to do with that. So I'm not getting too specifics in terms of like we need this much protein and this much fat and whatever. You guys can figure that out for the individual. And then also just chatting with them about what digests well for them, what works. Making sure that they do have carbs on a regular basis. So we talked about this, like sort of the low carb, easy slip into a low carb diet on a low FODMAP diet, or when considering FODMAPs, if they're not guided properly, right? And then a balanced diet overall. So this is the one that oftentimes gets ignored by athletes, and it sounds so silly, but really, I was listening to, Nike has a wonderful podcast with short episodes called Trained. And I was listening to LeBron James' Trained episode, and he was basically talking about how training is a lifestyle. Like, it is not just what you do during your actual training moments where you're doing the exercises and going through, you know, your drills or whatever, but it actually is like how you sleep, how you eat, how you manage your stress and all of that. So this is, you know, this should not be ignored. If anything, I would say this is probably the primary focus, although it's, you know, it could be kind of tossed between the two. So those are our considerations when we're talking about fueling. Okay, so then why do we want to use a low FODMAP diet? So this is just a couple of studies and little quotes that I threw in here, but basically, you know, you've got the evidence kind of speaks for itself. There are lots of studies evaluating low FODMAP diet for IBS and show that there is significant relief of IBS symptoms with the low FODMAP diet. There are also a good amount of studies evaluating the low FODMAP diet in GI symptoms and reduction of GI symptoms for athletes specifically. So this is just giving you a little bit of support for why we would even be talking about this. Athletes have a higher FODMAP intake due to them, hopefully, we hope, right, that this is the case, attempting to meet energy requirements and to vary their diet and increase their intake of food and nutrient-rich fluids, right? You know, in general, there is absolutely a problem of underfeeding and athletes not eating enough. But there's also this idea that athletes can like eat whatever they want because of the amount of time that they train. I'd say that's probably the better end to come from, because we can always like pull back or tweak it. But we have to consider that FODMAPs are part of that, right? So a typical diet of a multi-sport athlete includes 80 grams a day of dietary FODMAPs, which is compared to about a 25 gram a day amount of FODMAPs in the average Western diet. So this is why this is a major consideration. So simply put, when we're talking about just like general healthy eating, or, you know, helping an athlete to understand, like an athlete with IBS to understand what they can eat at certain meals, they may feel overwhelmed. So there's a couple different ways that you can approach it. You know, there's the gentle low FODMAP diet approach. So the low FODMAP diet can really be interpreted in many different ways. And I think the gentle low FODMAP diet approach is really nice for someone who, even though they might benefit most from doing sort of the traditional or more strict, you know, 2 to 6 week elimination period and then reintroduction period, if an athlete's just overwhelmed and like not interested or just bogged down and you're just gauging that that's not going to be a good idea, go with the gentle low FODMAP diet approach. It's going to work and it's going to do something. And then you can also just, I would say maybe sprinkle this into like having them understand it in general, so that in general they understand where their FODMAPs are coming from and can kind of tailor that throughout their day-to-day. But there's evidence to support that even just eating low FODMAP 24 to 48 hours before an event or a longer training day helps to reduce GI symptoms significantly. And finally, you can use a meal delivery service like Epicured that takes the work out of it for the athlete, and especially if they're professional or they've got, you know, if the sort of like money isn't an issue, I would just say have them do something like that, where it's just makes their life easier. You put the food in front of them. That's kind of what the training table's doing, or the fueling table's doing when they're in their training facility. So you can just, you know, suggest things like this or products that are low FODMAP that just make their life so much easier. Okay, so let's get into the supplementation during exercise. This is sort of my favorite part because it's really technical. A study by Sinai and others showed that 15 grams of glucose before exercise starts, and then roughly every 20 minutes during exercise, so it's roughly about 45 grams per hour, 15 to 20 minutes, I guess you could say, during a 2-hour endurance event, completely prevented epithelial injury, reduced small intestinal permeability, supported endotoxin clearance, and it reduced markers of physiological strain. And also in GI symptoms, incidence, and severity, it did not intensify during exercise or afterwards when compared to just ingestion of water during exercise. So they compared just glucose or carbohydrate ingestion during exercise to just water. So it's important, and I think that's a big takeaway from today, is that you need to look at hydration and supplementing or ingestion of just glucose, and we'll talk about fructose plays a little bit of role in there too. So a couple things to note, and this is where I really nerd out and love this stuff, but so glucose and maltodextrins use, remember everything's got a glucose transporter, right? So the sodium glucose transport proteins, or the SGLT1, that is used for absorption of glucose and maltodextrins, but we'll focus on the glucose. Those are found in the intestinal mucosa and the enterocytes. We don't want to injure those guys, right? So we keep talking about that. The SGLT1 becomes saturated at a capacity of about 60 grams per hour. So that's where that number comes from, of like sort of that time release of administering the glucose over about 15-20 minute periods over an hour. And then I just put this little note to don't forget the sodium with the glucose. So that's why like a Gatorade or a nice electrolyte balance is nice. You know, that's why I would kind of steer away from, this is an off example because I'm talking about potassium with this, but that's why like, you know, a coconut water, which would be really high in potassium and contains little to no sodium, is not the best electrolyte supplement. And then fructose. So fructose uses the GLUT5 receptor, or the transporter, for absorption. And that's expressed also in the enterocytes of the small intestines. Fructose intolerance is said to be a deficiency of GLUT5 in the enterocytes. There's a couple of different mechanisms of action there, I think, but GLUT5 becomes saturated at a capacity of 30 grams per hour of fructose. So max absorption is 90 grams per hour, roughly, of carbs. Past this, they're just not going to be absorbed. They're probably going to hang out in the intestinal lumen and cause some GI distress. So when you're talking to an athlete about like how much of the goos or the glucose are you going to ingest, you want to talk about, are you going to do that with fructose and glucose? What works for you? And how much works for you, and how are we going to do this? And you have to really work through the logistics with them. So we'll talk a little bit about that as well. So endurance athletes might still have difficulties tolerating even just these little amounts of glucose, right? Just like how an athlete can train their muscles to do certain things to make them better at their sport, we can train the GI tract to tolerate certain things. And so it just sort of takes practice. So you really want to develop kind of a training schedule or practice schedule with your athletes that have IBS in terms of helping them to really test their tolerance to these different things, and really do that with a lot of time in advance of any events that they would do. This is a perfect time for athletes to tweak their training. Athletes I have a great friend who is one of the dietitians for a few of the Olympic teams, and it's such a bummer right now because their identity is tied to their sport and their teammates, and they're not able to see their teammates. And so their training is limited if they're, a team athlete or a group athlete and versus an individual. And so there's a lot of like horrible things that are going on for athletes right now, just given the COVID times. But there's also this huge advantage where I think we're going to see some really interesting things in sport after this, and when sports kind of open back up and we can see competition, because this is basically like a really long off season. So they've been able to do some really cool things, and this is really a great opportunity for nutrition to tweak, because you can really help an athlete test and be confident in their supplementation schedule or their eating schedule before, during, and after exercise. A couple things you want to think of that are just logistical stuff. Don't forget about asking, an athlete, like, okay, if I'm going to tell you to drink this much fluid during your run, where are you carrying it? What do you, like, I was just talking to one of my patients earlier who's an athlete, And there's the runners, you know, the bottles that like sort of attach to the hand that you can like run with. So it kind of feels like your hand's in just runner's position. There are belts, there are camelbacks. Some people just prefer to plan their routes around drinking fountains. Got to consider that, especially right now with touching public things. You just want to talk to them about like, where do you put your goos? Where do you put your gels? Because oftentimes I have had athletes as patients that I have been like, okay, we're going to do this. And they're like, yeah, I've been doing it. And I'm like, cool, tell me about it. Where do you throw your wrappers away? What do you do? And then they're like, okay, well, actually I haven't been eating anything during my 2-hour runs. So you really want to get into the logistics of it with them and make sure that they're doing it and just navigate that stuff with them. Okay. And then intake after exercise is a consideration in athletes with IBS specifically. And that's because there has been some studies that show, and I pulled this one from the exertional heat stress study because I just loved everything I was reading in that. But basically GI symptoms were reporting during, that were reported during the exertional heat stress. So a 2-hour run at about a 60% VO2 max. So that's, you know, a higher intensity of exercise and at higher use of oxygen in a hotter climate led to GI symptoms at 58% during the 4-hour recovery monitored period and 12 hours post-exercise. So you have to think about how that affects the nutritional absorption, because that's the compromise in absorption of nutrients it goes with those GI symptoms. You have to think about how that compromises the nutritional absorption for anything that an athlete plans to eat in 4 to 12 hours after exercise, basically. And then that's going to be that compromised absorption is going to be increased in patients with, in athletes with IBS. So you just want to make sure that you consider that. For this one, I would say you kind of want to, I mean, it kind of goes back to the same thing I've been saying. You really want to talk to the athlete about figuring out, you know, do they absorb a liquid meal better right after exercise or a few hours after exercise? Do they exhibit symptoms or kind of like an adversity to eating? And how do you work with that and just kind of getting creative? Or are they fine with solid foods and everything seems to be absorbed nicely? It might be fine for them. So you just want to talk to the individual and find out what works best for them. It's a lot of trial and error. These are a couple things that I just wanted to put out here too. So this is a list of low FODMAP supplements for mid-event fueling. I like a lot of these. I'm a big fan of Scratch Labs. They have, and I like the Martin stuff too. I didn't put that on this slide, but Scratch Labs also has 2 books. I think they might even have more than that because there's a chef that's part of their, I think he's one of the founders. I'm going to mess that up. But anyway, they have a book. They have 2 cookbooks. One is about just like helping athletes develop just like healthy meals. That's great. Not necessarily low FODMAP, but their stuff just generally tends to be like more GI friendly because they're considering these compromisations that happen during exercise to the GI tract. And then they have another book that's really talking about like making your own mid-exercise, like homemade supplements, which is pretty cool. So just a little shout out. Okay, hydration. It's a big deal. I always make the joke that my patients of all types and my athletes specifically are probably tired of hearing me talk about hydration and getting enough water. There's a couple of ways that you can assess fluid balance and fluid losses in an athlete. You can use a sweat rate testing. A lot of people just have like an Excel sheet that just plug numbers into. That's how I do it, to just get a sweat rate. So you just have a patient or an athlete weigh themselves before exercise in the nude. Go out and exercise and then, you know, do it for an hour and have them not consume any fluid. Like, you know, they urinate, they weigh themselves in the nude, they go out and exercise, and then they come back, weigh themselves in the nude after exercise and after not having peed again and not having had consumed any water or supplements. And then that water loss is used to then convert it into milliliters. I'm sorry, the body weight loss is then used to convert to milliliters or ounces of fluid loss. So that tells us what their sweat rate is. And then a fluid balance assessment, really just using, I just put a little picture of ins and outs charts from clinical. Oh, where'd we go? Going backwards. There we go. So why is this important? Because if it's not repleted, body water losses may result in a significant reduction in plasma volume. So this goes back to the splanchnic hypoperfusion. So you don't want to encourage less blood flow to the abdominal cavity and to the GI organs, basically. So just, it's incredibly important for GI health and for athletes in general. I'm going to kind of whip through these slides. I just kind of included this information because I think this stuff comes up. So probiotics, glutamine, what else did I cover? Bovine colostrum, which we hear a lot about in the athletic community. I think it doesn't come across so much in the general community, and then curcumin or turmeric supplements. This just showed you a couple of quotes that I pulled from, I specifically pulled these from that heat study again, because I just wanted to throw these in there, that essentially what they found is that none of these had significant, showed significant improvements in any gastrointestinal symptom relief, more so than the low FODMAP diet did. And I know like glutamine and even some like other like branched chain amino acids and things like that are being pretty popular, and they're being talked about a lot and questioned. And I think you just have to, I'm going to leave it up to you guys to make your individual assessment, but I just thought I'd throw a couple of these in there because we can't really not talk about them. I will say one thing about curcumin is with turmeric in the realm of inflammatory bowel disease, there are some pretty good studies showing that 300 milligrams per day, so that's an amount that needs to really be supplemented. It's near impossible to ingest through food, like through turmeric itself. Does have some pretty positive effects on reducing inflammation. So that's just one thing to think about. And then just a few things, how diet differs for athletes with IBS. So athletes with IBS need to be more intentional with their diet to feel a sense of autonomy and confidence in their dietary choices. And that's really where the key to striking a chord with them is, and really hitting home with them. Talking with the athlete, just about not just eating and drinking whatever their teammates are doing, or, you know, really having like the mind of their own in terms of choosing how to take care of their body and not just doing what everybody else around them is doing. And then encouraging athletes to work with dietitians. I mean, I don't need to tell this audience that, and drive that home. But really, you know, our responsibility is to help them confidently identify what their food triggers are for symptoms, with the goal to then allow them to have the least restrictive diet while managing their symptoms, right? And then helping them to understand that diet's not just it's not the only factor that's going to affect their symptoms, especially if they're athletes, right? And really, I think most sports dietitians have to understand GI nutrition as well because of all the factors that we've talked about today. Athletes with IBS, in my opinion, my humble opinion, I think that athletes with IBS are at an advantage over athletes that don't have IBS because they have to be more intentional about their diet slightly, although most athletes need to be, but also they're sort of, it's like a blessing in disguise that they have to tackle their symptoms, because we're seeing here with all this data and evidence that there's compromise to the GI functionality in people without IBS, even when they, you know, just in exercising, we see that. I mean, I full disclosure, like I do not have diagnosed IBS, and I've had some symptoms when I ramp up my training for running and things like that. I've noticed that, and even in myself, and this totally brings it home and makes sense to me. So just wanted to kind of drive that point home. The big thing too is that, you know, I showed that this study kind of evaluated this, but that endurance athletes most commonly reported, you know, talking to friends and their coaches about their GI symptoms, and then getting nutrition knowledge from those same sources. So athletic trainers, you know, have a little bit of nutrition training. Many teams do not have a dietitian. So a lot of athletes, when they get to sort of the pro level, semi-pro, really serious about their sport, that's when they start to like look for a dietitian, or if they have, this is what I'm saying, kind of like been blessed with a condition and being diagnosed, and they sort of are looking for those specialists already. So And you want to just encourage the athletes to discuss symptoms with appropriate medical professionals so that they really understand that, like, this isn't normal. It's not, you know, it's common, but they shouldn't, you know, always feel stomach pain and things like that. Just things that we're looking out for normally when we're evaluating somebody for symptoms, and or when we receive somebody that's had a diagnosis of IBS, just wanting them to understand, like, what's more common, what's not, when does it sort of get to a point where we need to, like, address these symptoms. Okay, so the big take homes for all of this, just to wrap things up, are, you know, the biggest thing I'd say is do you want to watch overtraining and underfueling? And the reason for that most of the time in athletes with IBS is a lack of information and a lack of confidence in their food choices and their nutritional knowledge base. And so you want to do all that you can to develop a really nice rapport and a solid trust between you and your athletes that you're working with, to make sure that, you know, they're trusting you and that they are coming to you with questions to be the ultimate, like, say in what's good for them and what's not good for them in terms of their nutrition, and that they do feel confident enough, because you're not going to be with them all the time. So when they're on the road or they're with their team or whatever, that they're making the right decisions for their body. So don't want to forget that exercise is a form of oxidative stress. And since FODMAPs are malabsorbed carbohydrates, following a low FODMAP diet might result in a low carb diet, and that might not be great for the athlete's energy availability in terms of what their diet's providing for them, and then their energy stores in terms of the glycogen. A lot of sports nutrition products contain high FODMAPs, but there are also a lot of low FODMAP options. So just knowing what those are and making those really convenient and available for the athlete. Looking for signs of disordered eating. That's also a major factor when it comes to overtraining and underfeeding. It's huge, huge, huge. It's huge in the GI space. It's huge in the athletic space. So when you combine the two, it is probably the biggest thing that you need to consider. And I said this before, and I'll say it again. It is not, I didn't talk about it as not enough in this group of slides, just for the sake of time and the topic. It needs to be heavily considered. And then autonomy and confidence in dietary choices. That's the number one thing that you want to ensure that your athletes have. So make nutrition info fun, available to them, make it simple, make it easily attainable, get them on a meal plan, get them a meal delivery service or something like that, and just make it super easy for them. And that is it, you guys. Does anyone have any questions?
Yeah, we do have questions. That was fabulous. Thank you, Lauren. Just, I know we only have a few minutes, and feel free to hang tight for those of you, because I'm sure we'll go a little bit over. So we do have a question regarding IBS subtypes and exercise related to the low FODMAP diet. So would this be appropriate for all subtypes? If someone was constipation predominant, would you consider, you know, a low FODMAP diet as you would, you know, someone with IBS-D or with diarrhea as a symptom?
Yeah, that's a good question. Well, so the low FODMAP diet's appropriate for IBS, period. So it really works for all types. I think what you would want to look at for different types, so, you know, we talked a little bit about how exercise can affect GI motility. So you would want to look at, you know, when did the constipation start? Has the constipation been a lifelong problem if the patient's constipation dominant IBS? You know, is it something about just generally getting their bowel movement regularity functioning at, you know, like a more regular pace? And that's kind of the challenge that you're looking at. Or is it something that started once they started ramping up their training or increasing their load, we would call it in the athletic world. So like if they're a runner, increasing their miles per week or increasing their speed at which they're running. And then that started to, because of that increased intensity, started to compromise their GI motility. That kind of goes for both ways. Like they could start having like runner's trots and runner's diarrhea, for the same reasons, right? So you want to look at, is this new? Is this existing? So short answer is yes, the low FODMAP diet can be applied to all types of IBS. Long answer is you can manipulate different things. So you would want to look at like hypoosmolarity or hyperosmolarity of what they're ingesting. Maybe they're having like too much glucose, or there's too much sodium in a supplement that they're taking or a sports drink that they're drinking. And that's causing them to have diarrhea because it's attracting water into the intestinal lumen, versus maybe they're having too much or too little fiber, or the type of fiber that they're getting, if it's, soluble versus insoluble, is creating a problem on either end of the type of IBS.
Yeah. I think, at the end of the day, when we're working with patients, I think the big message is it's individual, right?
Yeah.
Not one size fits all. And it really is listening to the patient, acknowledging what's working for them, taking into account so many factors.
Yeah.
Into finding what's going to work. Another question we have here is regarding the hydration, and to measure someone, the question was to measure post-exercise weight loss. Did you say afterwards, should they urinate before weighing them after they exercise? I think the answer is no. You have them weigh themselves naked, go exercise, come back, weigh prior to going to the urinating again. Yeah.
So you can, so if you Google like sweat rate test, you'll find information on this too, just because I know it sounds kind of complicated. So, and I was even, as I was going through it, I was like, okay, wait. So you basically want to make sure that they start and stop with a balance of no incoming or outgoing fluid. And you're measuring body mass loss and then converting that into ounces or milliliters of fluid. Right? So if you start at 0, meaning the patient hasn't, or the athlete hasn't consumed any water, or close to, they've peed it out. So you get them to urinate before they get on the scale, and they get on the scale naked, right? And then they go do their exercise. They don't consume any water or any sort of fluid or any sort of supplement during just a 1-hour exercise. You want to cap it because you don't want to, cause them problems. And then they come back. And so there hasn't been any losses, meaning don't have them go to use the restroom before you weigh them. Then weigh them naked, or they're usually doing this on their own and just reporting the weights to you. But yeah, Good question.
So another question from a colleague that is a sports RD. She works with quite a few athletes who have digestive issues but do not have a diagnosis. Do you know of any screening tools to determine what the issue may be from a dietary standpoint? And I guess number one, right, always refer to the doctor if it's something that's new or concerning, right?
I would punt to that. So dietitians don't diagnose, and I always prefer that, like, even if somebody's coming to see me for gastrointestinal symptoms, that they've been evaluated by a gastroenterologist, like have them see a specialist, not just a physician, because we don't want to guess, right? So, I think I didn't even talk about this. I think it might've been in my notes, but I might've skimmed it. That there was another, I didn't put it in there because it was more heat induced. There's another example of an athlete that it was in the Rio de Janeiro Olympics in 2016, where he was having hematochezia, and so he was having blood in his stool and had to completely pull out of an event. He was a walk marathoner, I think, and it was due to the heat. So it didn't have as much to do with like just IBS and athletic performance, so I didn't put it in here, but he had blood in his stool. So you could, as the dietitian, think, oh my gosh, this patient has inflammatory bowel disease, but that's not necessarily the case. Hematochezia can happen. So I would just say, try to get them evaluated by a specialist.
But I want to be clear, because she was not asking specifically about the diagnosis. She was saying that initially, but just for clarification, are there any recommended assessment tools to help determine what the issue may be from a dietary standpoint? So first and foremost, patients should get some referral to have that assessed. But then are there any assessment tools to help with you deciphering
like which
kind of from a dietary standpoint, like, this patient will benefit from X, or
that's a good question. I honestly, Old Faithful, I have the patient or the athlete keep a food symptom bowel movement log. I ask for kind of a lot in my log because I really want to get down to it. So I ask them to tell me, like, if they can, in chronological order. If they use like the Monash app, and they, the Monash app will ask them to put the date and time. So it gives you a nice little story. Because I want to see, like, if a patient wakes up, doesn't have symptoms, doesn't eat breakfast and then goes and trains for 2 hours and then comes back and then has symptoms and just like can't eat after that, versus a day where they don't train like that, and they have no problems digesting food, then I might look at like, okay, it looks like it might be that you're not eating during your exercise. I mean, that's sort of a given the information that we talked about. But I think a food and symptoms and bowel movements log can tell you a lot, and you can start to see trends and patterns that will start to surface what the issues are.
Okay, good. She'd also mentioned that the Bloated Belly Whisperer, which is Tamara Froman's book, has a little quiz.
I have that book back.
So I just wanted to share that with the group. Okay, let's see. And I think there might have been a few other just quick questions. Difference between whey protein isolate or hydrolyzed whey protein. Do you use either of those, or FODMAP?
Yes, and to be honest with you, I always double check myself on these because I constantly, like, I kind of do this to make an example for my patients. Like I always say, like, you see me, if I administer the low FODMAP diet all day, every day, you see me checking myself, so you should check yourself on everything that you're doing in terms of just these little ingredients. Kate, you might be able to speak more to this specifically, but I think when it comes to whey protein, I kind of leave it to the individual to see what they tolerate beyond just what's high FODMAP and low FODMAP.
Yeah.
And then if they don't tolerate whey just in general, or it just feels like it's a little bloaty or a little gassy, I kind of just go to a different type of protein maybe. Whey protein, in terms of the synthetic proteins, is tested to be, the most bioavailable and absorbable, but there's also a lot of new research coming out showing that the combination of pea and rice protein is just as bioavailable and absorbable. So there are options. But yeah, I don't know. What would you say about that, Kate?
Yeah, well, I know the whey protein isolate would not have the lactose compared to like whey protein concentrate. So
right.
That from a lactose standpoint, from a FODMAP standpoint, that would be the concern.
Right. So then I would start there. And then I would say, if the patient tries the whey protein isolate and it's still kind of it doesn't feel great or just doesn't digest well, then maybe they try something different.
Yeah, I mean, that seems very reasonable. Now, where can we find, just a couple more questions, so we're really close to wrapping up. Where can we find the low FODMAP supplements to make or purchase?
Oh, you can find them in a lot of different places. Honestly, Amazon has most of them. I have a couple favorites on my website, but you can get them on their websites. So, just ordering, I honestly just tell my patients, go to their websites and order straight from there. Amazon, I'm trying to think, it depends on where you are too, because I know FODMAP Every Day has a little bit of information on which low FODMAP athletic supplements are available in Canada or the UK only, or if you're in Australia, which ones you can get there and things like that. I'm trying to think if there's any more specific information I can give. I mean, I feel like most of them are pretty available. Also, going into runners stores or REI, if I need scratch labs and I'm out of it, I prefer I just like the way they taste too. I go down to REI and grab them. So a lot of outdoor sports stores or running stores will carry a lot of them too.
I also have just Kate Scarlatta Pinterest board that's called FODMAP Runner. And
yeah,
it's been a while, but I pinned a lot of supplements on that board just to find some of the ones that don't have the FODMAP ingredients. So that's just another resource, and then you can link right to the store.
Oh, that's
and then quickly, any comment regarding lectins and GI distress? I know there's I don't know that there's a lot of data on that.
There's not a lot of data, and I would say
more hype than science.
Yes, I kind of have a strong opinion about it, but I just think it's more hype than science.
Yeah.
Yeah.
All right. Well, I think we've taken up more than enough of your time. This was fabulous. Thank you everyone for listening in. We have another fabulous webinar next month from a GI psychologist. So flipping the tables and doing another area of you know, science to explore. So, you know, be in touch. And thanks again, Lauren.
Cool. Thank you guys so much.
Wonderful presentation. Thanks everyone. Talk
Bye,
to you
guys. Thanks for having me.
For everyone, you'll get your completion certificates via email, and we'll be able to access the recording of the presentation on our Partners in Health resource portal. Have a wonderful evening, everyone. Thanks again, Lauren and Kate. Bye.
Yeah, no problem. Bye, you guys.
Bye.